The social cluster ministerial oral reply session in the NCOP started with Tolashe. She says with the rise in social ills, including GBV and femicide, the shortage of social workers is being attended to.
Whilst the level of social ills is increasing in the country because of the scourge on pervasive social ills, including gender-based violence and femicide, the numbers of social workers are not enough to respond to the scourge. And therefore, Chair, the government's commitment through the National Development Plan Vision 2030 to strengthen and expand the number of social service professionals in government. They are now currently have employed 23,561 social service professionals. And these professionals are categorized as follows: social workers, social auxiliary workers, child and youth care workers, community development practitioners. Out of 23,561, the Department of Social Development employed 18,948 with the following breakdown. The social workers are 11,070, social auxiliary workers are 2,822, child and youth care workers are 2,517, as well as community development practitioners, which are 2,538, and that gives 539, That gives us a total of 18,948.
They faced the follow-up question on the time frame for implementation.
Honourable Minister, I think the public is having a problem with all of us to say every now and then we are talking, but we don't come with a time frame. So if we can just indicate to the public when can we, the time frame on the implementation of the strategy.
The approved strategy of employment of social workers, social service professionals will be realized and implemented through a developed program of action that will start from 2025 financial year until 2030. This program is responding also in the National Development Plan Vision 2030.
Questions and concerns were also raised on the medical front about the prevention of deaths as a result of various non-communicable diseases. The DA accused the health minister of vilifying private medical aid schemes that may play a role in the prevention of these diseases.
Minister, your deputy's response to the NDC pandemic on the 16th of September 2024 included a call for collective action from all sectors of society, not just government. Whilst this is an indicative of your relation that government and its draconian unimplementation and unfunded NHI bill alone cannot attend to all South African needs, how will this collective action be achieved when you are continuously and aggressively vilifying private medical schemes who have the necessary resources to prevent, detect, and effectively manage NDCs?
But the health minister told the DA how the inactivity of private medical aid schemes is not helping to prevent non-communicable diseases.
I don't know about the vilification part of it, but what I do know, as a matter of fact, is that I've spoken to many medical schemes why they are not active in the field of prevention, because one of the biggest treatments of diseases, including NCDs, is prevention of diseases and promotion of health. And I've raised this issue. Take, for instance, out of NCDs, but talking generally about prevention, I have queried medical aids why they are refusing to pay for contraception. That is also prevention. They refuse to pay for a contraceptive pill, which may cost 60 rand. Then the young girl goes to fall pregnant. She commits a backstreet abortion and gets complications, move into ICU. It costs 100,000 rand and the medical aid pays. I have raised that with them, that I find it ununderstandable and unwise. That does not mean vilifying them. And so when you raise this issue sharply, it has got nothing to do with vilification. because the issue of primary health care is very important.
Other questions that Motsoaledi faced include the measures taken by the department to integrate mental health services into its broader strategy and to combat non-communicable diseases such as hypertension, diabetes and heart disease. Mercedes Besent, SABC News, Parliament.